This week we get to pull everything together and get some ideas on how to be a good healthcare consumer. Healthcare consumerism was one of the topics that I like to introduce in the corporate world because it had a huge impact on return on investment for the employer and offered valuable resources for the individual. What is healthcare consumerism? Think about taking a responsible approach to your health. Remember, taking steps to engage in health behaviors and eliminating risk behaviors will enhance your well-being. Let's dig a little further. Self-care is like the old saying, an apple a day keeps the doctor away. So, what is self-care? First, know your health status. Do a personal assessment. Ask yourself, do I smoke? Am I overweight? And be honest with yourself. Periodically take a health risk assessment if you have access. Know your family health history so that you can take the steps necessary to reduce your risk. Learn what screenings and immunizations are appropriate for you and have a conversation with your healthcare provider. Then follow through. And get baseline numbers. Cholesterol and blood pressure are the two big ones to establish early and watch as you age. Does that say self-treatment? Yes, there are times when you can diagnose and treat yourself without going to the doctor. Self-diagnosing symptoms or conditions that occur frequently but may not require physician visits, such as the common cold or minor abrasions, can save you time and money. Using over-the-counter remedies to treat minor pains, scrapes, stomach upsets, or cold or allergy symptoms can also save money. Performing first aid for common, uncomplicated injuries and conditions can give more immediate relief and begin the healing process. Learning from reliable self-help books, websites, and videos can be helpful. A little more on this in a few minutes. Preventive care is important and sometimes gets overlooked when you are young and healthy. Perform monthly self-exams such as breast, testicular, and skin. Strive to get a preventive exam every year. Participate in periodic checks for blood pressure, cholesterol, blood glucose, and others as prescribed by your physician. And make sure that you are up to date on your immunizations. Finally, what we have been talking about all semester. Engage in health behaviors. Maintain a healthy diet. Get enough physical activity. Get adequate rest and relaxation. Perform meditation and other relaxation techniques. And avoid hazardous behaviors such as tobacco, excessive sun exposure, and drug and alcohol abuse. Having a self-care guide easily accessible is a great idea. You can invest in a print book. Two popular versions are the HealthWise Handbook and the Mayo Clinic Family Health Book. They look at common health issues and provide self-care treatment based on symptoms and indicate when you should call 911 or your physician. You can also find mobile apps that provide helpful information. The WebMD app provides access to mobile-optimized health information and decision support tools, including WebMD's Symptom Checker, drugs and treatments, first aid information, and local health listings. The American Red Cross First Aid app provides expert education to deal with first aid emergencies on many first aid topics. It also identifies when to call 911. The ZocDoc app enables users to find doctors, read real reviews, book appointments instantly, and more. It can identify local doctors in the user's insurance network. GoodRx makes comparing prescription drug prices easy. The app provides current cash and sale prices, manufacturer coupons, pharmacy discounts, and valuable savings tips for thousands of prescriptions at pharmacies throughout the country. Here are some reliable resources for self-care: the Mayo Clinic, WebMD, Harvard Health Publishing, and Nemours Foundation Kids Health. Be sure to review the tips on when to seek help, choosing a healthcare provider, and your rights as a patient in your textbook. Let's talk about health insurance. Currently, 28.2 million uninsured Americans do not find health insurance affordable. That is over 9% of our population. In 2016, the average family's annual health insurance premium was more than $18,000. Most of the premium is covered by employers if you are fortunate enough to work for a company that offers health care, with the worker paying 15 to 25% of the full premium. Finally, lack of health care is associated with delayed health care and increased mortality. The Patient Protection and Affordable Care Act, known as PPACA or simply ACA in the healthcare world, you may also know it as Obamacare. I usually hear groans when I talk about ACA. No matter how it has affected you in real life, it definitely has had some positive impacts on health promotion. The law is vast and covers a wide range of organizations. We will talk about some of the more positive pieces in the health insurance arena. Let's take a look at some of the rules for health insurance coverage. Preventive care coverage, such as annual or well visits and certain immunizations and screenings, must be covered at no out-of-pocket expense. All individual and small group plans must cover at least one drug in every category and class of approved medications in this country. Plus, drug costs must be counted towards out-of-pocket caps on medical expenses. Previously, many plans did not cover mental or behavioral health services. However, that has changed with PPACA. Children under age 19 are able to get their teeth cleaned twice a year, as well as receive x-rays, fillings, and medically necessary orthodontia. In addition, children under age 19 are entitled to an eye exam and one pair of glasses or set of contact lenses a year. Relatively few health plans previously covered children's dental or vision. PPACA classifies prenatal care as a preventive service and must be provided at no additional cost, and it requires insurers to cover childbirth as well as the newborn infant's care. These maternity benefits were a welcome breakthrough for young people, as 2/3 of individual plans have traditionally excluded this type of coverage. Coverage for children to age 26 is a huge benefit for young adults without providing proof of college enrollment. This covers adult children of covered individuals who may not otherwise have access to coverage. No exclusions or pre-existing conditions, and no annual or lifetime limits on benefits. PPACA provides positive changes that bring better coverage to those who are insured. Let's talk about the financial terms when it comes to health insurance. Your premium is the monthly amount that you must pay to keep your insurance active, kind of like your monthly car payment. A deductible is the amount that you must pay before your insurance kicks in. For example, say your plan has a $2,500 deductible and you break your arm and the bill is $10,000. You would have to pay the $2,500 and the remainder would be covered by your health plan based on your plan. More on this later. After you meet your deductible, you pay a percentage of the healthcare services called coinsurance. One plan could split the coinsurance at 85 to 15% for in-network physicians and 60 to 40% for out-of-network physicians. Make sure that you pay attention to the fine print and opt for in-network physicians to keep your expenses down. The copay is a set fee that you pay to the physician when you are sick or need services. For example, you may pay $20 to your PCP, $30 to a specialist, and $50 for an emergency room visit. These fees are usually listed on your insurance card. Okay, let's look at the example of a broken arm that requires surgery. This will probably cost about $16,000. Before we even get to the broken arm, you will need to make monthly premium payments. Currently, the average premium amount is $575 per person. If you are fortunate enough to have your employer fund some of your premium, they may pick up $464 a month. So your share is about $1,380 annually. Now, the broken arm. Your insurance plan has a $2,500 deductible, so you are required to pay that amount before your insurance kicks in. You go to an in-network doctor and the coinsurance for in-network is 85% to 15%, meaning that your insurance will cover 85% of the cost and you must cover 15%. After you pay the deductible of $2,500, there is $13,500 remaining. 15% of that is $2,025. In addition, you can incur copay expenses when you visit your PCP, a specialist, and the emergency room. In this example, let us say that you visited the emergency room at $50 and then had a follow-up appointment with an orthopedic surgeon at $30, totaling $80. That brings the total for the broken arm to $4,605. Now, of course, if you have already met your deductible for the year, then you would not be responsible for the $2,500 for this claim. That is why you will often see individuals schedule elective surgery at the end of the year once their deductible has already been met. And referring back to PPACA, remember that preventive care is covered outside of the deductible. You can obtain health care insurance privately or through the exchange. Private insurance is usually employer-sponsored. Sometimes you will see consortiums or professional organizations offer private insurance as well. About 65% of our population is insured through private insurance. All of these plans must be PPACA compliant. However, the employer establishes the plan, such as the deductible, the coinsurance, and the copay amounts. In larger employers, employees often have an option of 2 or 3 plans. The exchange offers government-funded insurance, and about 25% of our population is insured via the exchange. This leaves a 10% gap who are uninsured. The plans on the exchange are PPACA compliant, and there are 4 tiers, which categorizes plans as platinum, where they cover about 90% of expenses, gold covers about 80%, silver about 70%, and bronze about 60%. Of course, the platinum plans will have the highest premium, and the bronze plans will have the lowest. There are 3 options in the marketplace. Medicare is a federal insurance program that covers 99% of people over age 65, all totally permanently disabled people, and all people with end-stage kidney failure. Medicaid is funded jointly by federal and state funds. It covers approximately 58 million low-income people, including many who are pregnant, blind, disabled, elderly, or eligible for temporary assistance for needy families. The Children's Health Insurance Plan provides health insurance to more than 5 million uninsured children and is jointly funded by federal and state funds. HSAs, HRAs, and FSAs are accounts used to save on taxes and pay for qualified medical prescription, dental, and vision expenses. You can use these accounts to offset the deductible, the coinsurance, and the copay associated with your healthcare expenses. Typically, you put funds into these accounts through pre-tax payroll deductions. They are highly regulated with limitations on how much can be placed in these accounts. An HSA is a health savings account. You can only have a health savings account if you have a qualified high deductible plan, and you can only have one account between spouses. Both you and your employer can put money into this account. However, the money in this account is yours. This money is only available as it is put into the account. An HRA is a health reimbursement account. Your employer can offer this to anyone. The HRA is funded solely by the employer. However, the employer owns this account and it must stay with the employer if the employee leaves the company before the funds are used. Depending on how the employer sets up the account, the funds may be able to roll over from year to year. The total annual contribution is available immediately. And an FSA is a flexible spending account. This account is also an employer-owned account where both the employee and the employer can add funds. However, all funds must be used by the end of the year or they are lost. You can have an FSA for health care and/or dependent care expenses, such as daycare. This is a great pre-tax benefit if you are paying for childcare. Here are some ways to save on your healthcare expenses. Use doctors, labs, hospitals, and other healthcare providers who are in your network. They charge lower negotiated rates, plus your coinsurance is lower. Out-of-network providers can balance bill, which can be costly. Keep up with preventive services to catch problems early. Most plans you pay nothing as long as you stay in network. Generic drugs can be just as effective as name brand, and they cost less. You can also save by using your plan's home delivery service for regular prescriptions. And don't forget to download the GoodRx app and use it. Use your cost of care tools to compare costs before having health care services performed. You can usually find these tools on your plan's website or mobile app. Visit an urgent care center or walk-in clinic for non-life-threatening medical issues instead of the hospital emergency room. You read about complementary and integrative health. Many choose alternative therapies over conventional medicine. However, you should always discuss your use of these approaches with your primary healthcare provider. The National Institutes of Health offers a great website to provide information on complementary and integrative health and natural products, safety information, and how to locate a practitioner.